o'clock. We want to begin tonight with COVID vaccines for kids. Today, the White House announced its plan to offer this COVID vaccination to kids between the age of 5 and 11.
So there is still some timing until this rolls out. The CDC and the FDA are still trying to decide if the Pfizer vaccine should be approved for younger kids. Tonight, Alice Barr has the changes that could happen and what all parents who are considering getting this vaccine for their children need to know.
With COVID vaccines for young children expected to be approved within weeks, the White House today laying out its battle plan to get shots in arms as quickly and painlessly as possible.
We have to be prepared to ensure that we can get vaccines to families as soon as the FDA and the CDC issue their decision.
If federal regulators authorize the Pfizer vaccine for children age 5 to 11, roughly 28 million kids nationwide will qualify.
I think that is amazing. I have been waiting for that for a long time.
It's something that I would definitely like to see a lot more information.
Instead of mass vaccination sites, the White House wants to use trusted locations like schools, pediatricians, and community centers. It'll be a smaller dose than the one for adults, even a smaller needle.
Kids have different needs than adults, and our operational planning is geared to meet those specific needs.
The Biden administration enlisting more than 25,000 doctors' offices, 100+ hospitals, and tens of thousands of local pharmacies to help with the rollout, from rural areas to big cities. Experts believe vaccinating kids means a big step toward herd immunity.
In the era of Delta, children get infected as readily as adults do, and they transmit the infection as readily as the adults do.
As the White House readies its plans, the biggest challenge may be overcoming hesitation among many parents to sign up their kids. In Washington, Alice Barr, NBC News.
Now, we reached out to IPS today about this vaccine rollout plan from the White House. They sent us a statement saying IPS recognizes vaccination as our best chance to move past this pandemic, saying the ability for nearly all of our student population to soon have access to vaccinations is a huge step forward toward getting back to a new normal for our schools. No decision has been made yet, but IPS is telling us it's going to follow Indiana Department of Health, CDC, and Marion County Public Health guidance when making a decision. And we've got some breaking news tonight at 5 into the newsroom. U.S. regulators are now allowing mixing COVID-19 shots for boosters. Also, the U.S. government has now given the green light to both Moderna and Johnson & Johnson boosters. Both of these issues have been before the FDA and the CDC within the last week. In fact, just last week, the FDA panel approved the Moderna and J&J boosters.
Today, during a White House briefing, a CDC director said people who haven't gotten the vaccine are more than 18 times more likely to be hospitalized with COVID. She also said the unvaccinated are 6 times more likely to contract COVID and 11 times more likely to die from it.